Thank you for joining us today on the program Healthy Living. I'm Adesu Wasawage. Every 26th of March, the world usually stands still only to celebrate World Purple Day. That is a day set aside to create more awareness on epilepsy. What do you know about epilepsy? Do you know how to manage it? All we know about epilepsy, or what some people know about epilepsy, is just to run away from a victim or somebody who is a sufferer, you know. Epilepsy, they worry, don't piante, don't run, you know. And other times, some of us will just bring out our phones and then be videoing a person who is having a fit, an epileptic fit. What do you really know? Today, we're going to look at all of that, and with the hope that you will learn a thing or two about this thing called epilepsy. So if you are ready, let's go meet our guest today on the program, Healthy Living, and they will be talking to us on this issue and telling us so many things, the myths, the causes, what you should know, that and that and that. So join me as I make welcome Dr. Mary Ehimigbai. She's a consultant psychiatrist from the University of Benin Teaching Hospital, and she's the president-elect M1. Okay.
Thank you very much.
And congratulations, you know.
Thank you.
I'm happy for you. Hopefully, you will bring ITV to that show on that day so that we'll cover and give us some money. All right, thank you for joining us. All right. And seated beside her is Dr. Ogo Ifeturi, a senior registrar at the neurology unit of University of Benin Teaching Hospital. Happy to have you join us. I hope I got that name right because it took me quite a while to get used to it. All right, doctors. 26 is tomorrow, actually, and today is 25th. So, World Purple Day. Exactly what are we talking about? Let me ask Dr. Hemingway, who is already done in the purple.
Yes, we want to talk about epilepsy, actually. You know,
let's talk about the day. The special day set aside first.
Yeah, 26th is a special day set aside. People have different themes for it. Like for us medical women, we want to talk about epilepsy. UBTH also has a program tomorrow.
That's for UBTH. They will come and talk to us. So let you and I talk about epilepsy now for that person out there to understand.
We want to create awareness. We want to talk about what epilepsy is and what epilepsy is not.
Okay, so what is epilepsy?
Yes, epilepsy is you know, firing of the brain, electrical signals that just, you know, spontaneously fires in the brain. It's a non-communicable disease that is characterized by convulsions, jerking, stretching, and all of that. It's not communicable.
So when you say firing of the brain?
Yeah, electrical discharges in the brain, that's a bit too much. That's
some electrical items in the brain. Is
well, the brain is actually full of electrical discharges, but they are tamed. They are kept in control. But when there's an anomaly, you find that people start having anomaly of these electrical discharges. You have bursts of them, and then people begin to jerk, they begin to stretch, and then not just jerking and stretching, there are other subtle symptoms of epilepsy that people don't actually know. Such people, when they come to the hospital, you say, did this child convulse? Because that jerking and stretching, our usual term is convulsion. So when you ask, did this child convulse, they tell you no, but there are other ways that people can have it without knowing, like twitching of the hands, you know, wriggling of the hands, you know, smacking of the lips. Blank stare. In school, it happens a lot to children, especially because of one type of epilepsy. We call it absence seizures. Where
that's epilepsy too?
Yes, it's epilepsy too. A child will just stare at the board. He's looking at the teachers, he's looking at everybody. They are not aware that the child is not in touch. The child has gone unconscious. And then it's very transient. After a few seconds, the child comes back and begins to write again. And then when this child begins to have issues with his or her academics, that's when they bring the child to the hospital. This child wasn't actually dull before, but how come this child is not able to, you know, follow up with academics? They'll now find that the child's notes is not making sense to him or her because it's not able to actually follow through with the teachers. So sometimes when they come and you ask, do you have any history of convulsion? They tell you, no, there's no history of convulsion. But when you ask the child or you ask the teacher may be able to tell you that sometimes the person just stares. It can actually also happen in adults. I had a patient who, when you're conversing with her, she would just log out. And she would not be able to respond. People would be thinking that she's hearing, but she's actually not hearing them. Her eyes are open, and then after a few seconds, she would come back. And then initially they thought, what could this be? And then by the time we did investigations, we found that she actually had epilepsy, and when she was treated, that was all gone.
Okay, let me take from what Dr. Mary said now. Dr. Ogo, you know that we're talking about children and before we come to adults. You know, like what she just described now, you see a child, you know, in that state. The next thing that child gets maybe is a smack on the back. Where are you? You know, either by the teacher or the parents. Why are you absent-minded? You understand?
Yes, exactly.
Nobody have really bothered to, like, check what really happens to that child. And the next thing is he's always absent-minded. She's always absent-minded, that kind of thing. So how can a parent or a teacher deal with this? Because it is happening in our schools, even at home. Parents do it. I'm talking to you and you're just keeping me quiet, not knowing that, like Doctor said, the child had locked off long ago.
Yes, exactly. So if this is happening over and over again, then the child should be brought to the hospital so the child can be assessed by a neurologist, because like you said, it may just, if it's happening over and over again, then something is definitely wrong. So the child needs to be assessed by a neurologist, and then we'll find out what exactly. We usually do an electroencephalogram, EEG, and then find the cause. And then
what should the parents look at for? What should the teacher look at for? Because we are quick to hitting our kids. Yes. What is that thing that they should look out for? Because this hitting of a child, because that child was a little bit absent-minded or something like you have described now, it should stop. All right. Yes. So what should a parent look out for? What should a teacher look out for? What should a caregiver look out for? You know, because we have done saying that it's not the child's fault.
Okay, if I may come in there before she, sometimes deterioration in academic performance is what a teacher may be able to look out for. Because sometimes when the child, for no reason, this child is intelligent. When you ask the child in his or her conscious state, is able to answer you well. But in exams, this child is not doing well. That's one sign that probably this child is not following in class. And probably when you take the child's notes, you find that it's not actually properly written. That's one thing they should look out for. Otherwise, there is actually no specific thing, because like I said, some of them, they don't check. They don't undergo this tonic-clonic. It doesn't switch to that.
That is what we know as a
yes, no. So it's just to, if it's repeated, because epilepsy is recurrent seizures, not just one-off. So if it's repeated, you know that this child needs assessment. They don't need to look out for anything specifically. Let them take this child to the doctor. Don't think that this child is just stubborn or this child is just staring at me. What's wrong with you? Some would think that oh, this child somehow, maybe some forces are using this child. You're staring at me. I'm talking to you. You're staring at me. Let them just go to the hospital. That's all. There's nothing specific to look at for
that it's very difficult for parents to do because epilepsy is a God forbid thing. It is not our portion thing, because parents will, you know, you can't just tell me that my child has epilepsy and I will accept. Now, when the child is not jerking, the child is not rolling, is not doing manifested all of those things that they used to manifest, and you cannot just ask me to do it. I will also tell you, it's not my portion. You know, so how do we make patients conscious now? What are we to do to propel parents to say that, look, at least take this child to the hospital, let the doctor confirm whether or not this child is suffering from epilepsy or one ailment or the other.
Okay, like she earlier spoke about deterioration in academic performance. Yes, so because veering away from epilepsy, even intellectual disability is something that should be spoken about and then brought to the neurologist to see. So if there's a deterioration in academic activity, the academic performance, then the parents should raise an alarm and go to the hospital.
Okay.
But most times that's not the case. Yeah,
It's not.
yes. So, and then what things we've spoken about, let's say checking the child notes and you see a lot of blank spaces in the notes, which could occur during those times when the child has gone off having the blank stares.
Okay.
Yes, exactly. And then the deterioration was said reoccurring, those blank stares reoccurring. So those are the basic things that they should watch out for, and then know that they have neurologists that are available to be able to take care of this.
Okay.
It doesn't have to continue.
All right, world over, we have about 50 million persons suffering from epilepsy, whether the person jerks or not. Once you have all of the symptoms that the doctors have mentioned, you know that this person is suffering from epilepsy. Now, what can we say is the main cause of epilepsy or causes of epilepsy?
Well,
I don't know if you can answer.
Yeah, epilepsy does not actually have a specific cause. There are numerous causes.
Okay.
It could be genetic. It could just be genetic, so there's no particular. Then it could be injury, trauma to the head is actually implicated. Then maybe tumors in the head. Sometimes it's during these seizures, they now do a CT scan, they found that there's actually a growth inside the head. So those are so then
inside the head or inside the brain?
Inside the brain.
Okay.
Inside the brain, impinging on the brain.
Okay.
And then you actually have sometimes infectious diseases could actually also be the problem.
Yeah.
People can have meningitis, encephalitis. Those are some infectious diseases that can also cause epilepsy. Yeah.
And
all right, go ahead, Dr.
Yes, to add to
Ogo.
that, one thing that we are commonly seeing in our clinic is also prenatal and perinatal injuries to the child.
Okay.
During childbirth, prenatal injuries, perinatal injuries, so the baby comes out and the baby doesn't cry immediately, the baby is asphyxiated, and then there's no, maybe no trained skilled birth attendant to attend to the person, and then the baby is not helped to breathe. That instant, that golden minutes is lost, and then the child comes off, and then very we start seeing them coming off with several seizures eventually, and even in the first year, some of them start having this.
That's pathetic.
Yes,
is it possible for an adult to suddenly develop epilepsy? Somebody who never showed the sign from infancy up to teenagehood and thereabout, and then the person just suddenly comes down with epilepsy. Is it possible?
Yeah, it's a possibility. We've seen cases like that. Like I said, environmental causes could cause that. For instance, trauma to the brain can actually cause that. Then chemical imbalance, to a large extent, can also cause that for adults.
Chemical imbalance, how?
We call them neurotransmitters in the brain neurotransmitters. They could just go anomalous at some point in their life, and that can cause it. Trauma especially. Then adults can also grow tumors. Like I said, tumors in the brain can also be a cause of adult epilepsy. Okay. And it's actually maybe after we investigate, because of the recurrent seizures, that's actually when we know that, oh, there's something growing in the brain. So adults can actually have epilepsy from secondary causes, yes.
Okay, Dr. Ogo, is it possible, is it so possible, scientific proven, that epilepsy can be wished on somebody? Or somebody can be cursed with it and the person will just get it?
Scientifically?
You know, growing up, we're told that somebody can just make incantation in water with lizard in it and then pour it on that person, and before you know what is happening, that person is down with epilepsy.
Okay, scientifically proven, I don't think so. I don't
spiritually
think so.
proven.
Then that, I think what you're just saying now brings us to the myths about epilepsy, because there are a lot of myths surrounding epilepsy. That's one of them.
Dr. Mary, let's talk about the myths now.
That's one of them. For instance, people say epilepsy is contagious. And that's why when we were growing up, you see someone fitting and having these seizures, and they just leave the person to go into the fire or go into the water and drown. Because people believe that when you touch, you now contact it immediately. No, epilepsy is not contagious. Some other people believe that, oh, all epilepsy, you must have that convulsions, tonic-clonic. Now, that's why we're here to dispel that myth, that it could just be twitching, it could just be blank stare, it could just be lip smacking, it could just be anything, it could just be tingling sensation. When people have that, it's still epilepsy. Sometimes, like absence seizure, it's a generalized epilepsy, as you know, minor as it looks. Then there are also other people believe that people can choke when they have epilepsy. So they try to put something in their mouth. That is so not advisable. What you do,
metal in their mouth.
In their mouth.
No, their fingers.
On their fingers. Sometimes they even chop their fingers off. That's not also good. Some believe that the tongue can fall into the mouth.
Yes.
So they now want to do something to prevent that. No, some believe that, oh, this person has to be restrained. Exactly. When you restrain the person, you do more harm. Yes. So what you do is to clear the environment, ensure that there are no objects, harmful objects, there's no fire around, the person is not near water to drown and all of that, and stay close to the person and allow the person to, fit and go through that process while you're watching, and then turn the person to the left lateral position. If you have a soft thing or something, put it on the head of the person.
Whether adult or
a child, turn the child to the or adult or anybody to the left lateral position, so the person does not aspirate. And then you put something, a soft cloth or something or anything by just on the head to support the head, and just wait for the person to go through the process and then come out of the unconsciousness. Usually does not last so long, but stay around the person. Some other people believe that treatment is not possible, which is also not correct, because 70% of people, over 70% actually, they are treated and they are well. I actually have
epilepsy.
Yes, I had someone that.
So it's not a lifelong thing.
No, it's not a lifelong thing. Yes, it's not a curable disease, but it can be well controlled. It's well treated and just like diabetes and hypertension, they are not curable, but they can be well controlled. That's the same with epilepsy. Well controlled. There are a lot of people that are. Some people believe that it's a mental illness. Epilepsy is not a mental illness. Yes, the brain is involved. It's not a mental illness. There are chances that people that have epilepsy can begin to have anxiety disorders. Every other person in the society who is, subject to trauma can also have anxiety disorders. So it's not peculiar to, epilepsy. Some other people believe that, it's associated with pain. There's actually no pain because the person is unconscious. But however, there could be no weakness, tiredness, muscle aches because of the jerking that is associated. Some people,
What should such a person avoid now? Those suffering from epilepsy, what should they avoid? What triggers the fit?
Okay, there is actually no specific one. Some persons talk about light, but it's actually in 3% of the population. Stress is a major, can be a trigger for anything. So they have to, minimize the level of stress. That doesn't mean they shouldn't work. They are not intellectually disabled. They should work. There are a lot of persons that, notable personalities, someone like, I think one of U.S. President, Theodore Roosevelt, he had epilepsy. There's this Thomas Faraday also had epilepsy. A lot of notable personalities like that you wouldn't know they did something with themselves. So it doesn't mean that when people have epilepsy, they should just go and sleep. They shouldn't go to school. They should be treated and allowed to go to school, but extremes of stress. And then also they have to be careful when they do some dangerous things like walking around the fire, driving. That doesn't mean that someone that has epilepsy cannot have, driving license. There are standard protocols that in Western climes, once they meet those standard protocols, they are given a driving license.
Okay, I think such person should be, educated on what to do. So that they will be able to save themselves. I actually watched a documentary where a woman left the daughter because she was epileptic, and then the father decided to take care of the daughter. So he was very watchful. Once he's so trained to get to the point that once the girl is
having the auras, we call them auras,
yes, she starts to clear things away, and then she just lie down by herself. She does not wait to fall. I think it's that falling and all of that usually gives them problems. She does not wait to fall. She just lay on the floor by herself, and then the fit comes and
takes its course.
Just to add to those auras, it could be smells, some sensations. It could be smell, taste. Those are some auras that people could have, and that
they just know that the fit is coming.
Then some can even have sharp headaches. They know that they need to just rest and calm themselves down.
Okay,
Okay.
in all of this, what's the way forward now?
Okay.
Yeah, okay.
Okay, so like just like what we're doing right now, awareness. People need to be aware that this is just like some people have hypertension and diabetes. People have epilepsy, it's a chronic disease, and then of the brain, and then it's not something to shy about. Or even people that have it, or relatives, or
Yes.
the parents, they don't want to talk about it. They don't want to, because the stigma.
Let's look at stigmatization now, because
Yes.
Dr. Ogo, you will agree with me that the stigmatization is huge.
Yes, ma. Yes.
It should. I grew up in an area in Lagos, and there's this young man, very nice-looking young man, very respectful, like, hello, hello, and one day we just saw him in front of the gate having this fit, and the thing made us to draw back from the young man, and before we know what was happening, they moved out of the area. The stigmatization, we didn't know, honestly, we didn't know. If I knew all of this, I wouldn't have been part of the crew that would say, now that guy, this thing for that day.
Exactly.
That kind of a thing. The
Yes.
awareness is not up to that point where people will say, oh, let us help.
Yes, yes.
The awareness is not there.
Yeah, that's why. That's why every year we come around to talk about it. We should, carry this message far. As many people that are hearing us, viewers hearing us, tell your friends, tell your relatives that epilepsy is actually not a death sentence.
Exactly.
It's actually treatable. It's actually, we've seen patients
But
were
people
treated.
can actually die.
Yeah, people can actually die from the complications. They can die from the complications. Some people have, drowned because there was no one to help. And it's still because people stare at them and because of the myths that if I touch, it's contagious. Some people had fallen and they now had head injury, and the head injury was what now killed them. Some people now, it's not the epilepsy. Then just one more thing, that this advocacy is important, but I also want to note that the treatment, anti-epileptic drugs, they are way now becoming very expensive.
Exactly.
Where many Nigerians can help, non-governmental organizations, the NHS, they can incorporate it into the system so people can afford it. That's the way people that are able to help can help to reduce the cost of these anti-epileptic drugs, because they are very expensive now.
Dr. Mary Ehimigbai, consultant and psychiatrist, and Dr. Ogo. I'm trying to remember the name. All right, Dr. Ogo. This is where I say thank you so much for finding time to join us on the program, Healthy Living. Hopefully, we'll do this on Thursday, the radio version, which is in Pidgin English, and then we'll get more calls. Okay. Thank you, doctors, for finding time to be with us.
Thank you.
All right, people, epilepsy is not contagious, okay? When you see somebody having a fit, please try and move things that behind that person away. And if you can help it, just help the person, get a comfortable position and turn the person to the left, right?
Lateral,
Lateral left, okay? Don't go and be shaking the person. Don't pour granite oil or palm oil or salt or spoon. You're harming and damaging that person's teeth if you do that, okay? So thank you for being part of the show today. We'll see you again next week, Monday. Bye-bye.